Okay, so here we go. The respiratory system. Now, watch. These are the functions of the respiratory system. And the functions of the respiratory system, the big ones, are to exchange carbon dioxide and oxygen. Right? The air that we breathe, right? The air is high in oxygen and low in CO2. And we learned, by learning the circulation of blood through the heart, that the pulmonary blood, right, the blood that goes into the lungs, is high in CO2 and low in oxygen. So, and as we know, things always go from high to low, right? The other thing is that the respiratory system warms, filters, and humidifies the air. And specifically, it's the upper airway. And I'll be more specific as we go through it. Now, anyone who's on long-term ventilation, they have a trach. So they lose their upper airway. So these people, because they've lost the effects of the upper airway that warm, filter, and humidify the air, they have to have a heater, they have to have a humidifier, and they have to have a filter on that ventilator. That's why if you've ever taken care of people who've been on a ventilator long term, you got to empty the little water things that get full of water, and you got to make sure that there's water in the humidifier because they lost the effects of that upper airway. And then probably the big one that you need to know is that it helps maintain the pH of the blood. And I'm going to write this down. CO2 is an acid. CO2 produces free-floating hydrogen ions when it's dissolved in the blood. And anything that produces free-floating hydrogen ions is an acid. So if you're not breathing so good, then your CO2 goes up in the blood and the pH of your blood begins to drop. All right? So those are the three big functions of the respiratory system. Now, if you recall from our study of the cardiovascular system, you remember that the goal of the cardiovascular system is to maintain blood flow. So whatever the body is demanding, the cardiovascular system has to produce, right? So the respiratory system is no different. So the goal of the respiratory system is to maintain airflow. So anything that interrupts airflow, that's going to be a big problem, right? So if you got a big sock stuffed down your throat, you will have problems breathing, all right? So what I'm going to do now is I'm going to take you on a trip through the inner part of the respiratory system. And as I go through each part, I'm going to explain to you its basic function, all right? So watch. This is a person who is, they're kind of in bad shape. They only have half a face, and if you look up here, their brain has been taken out. Yep. All right, so watch. Watch. Here's the larynx, or voice box. From the larynx up is the upper airway. So what I'm going to do now is define and explain to you the different parts of the upper airway. Right? Now, one of the big functions of the upper airway is to filter the air. Filter it. So the upper airway is loaded. The upper airway is loaded with blood vessels. And that blood is at 98.6, right? So because there's a lot of blood, if you ever got a bloody nose or, you know, bloody lip, right, that you bleed like a stuck pig. And the reason for that is there are tons of blood vessels, and blood is the radiator of your body. So because the upper airway is very vascular, this is what allows even cold air, when it's sucked in, to, by the time it gets to your larynx, it's warm to body temperature, right? The other thing that you want in your upper airway is you want the air to flow turbulently. So air that's sucked in through your nose gets into your nasal cavity. And that nasal cavity produces turbulent airflow. And that turbulent airflow allows that air to be cleaned. Boom. Now, this is why we have a nasal septum. So if you look, here's a person's nose, right? And in between, they have a nasal septum. So when you suck air in, air is going to go in this nostril and air is going to go in this nostril. And when it hits the nasal cavity, it's going to cause it to become turbulent. And that turbulent airflow allows it to be cleaned. All right? So the nasal septum separates the two nares. That's why we have two nostrils and not just one big one. And that those two nostrils allow that air to flow turbulently in the nasal cavity, and it will clean that air. So if you look, when you're breathing through your mouth, and you can breathe through your mouth, right? When that air is breathed in through the mouth, it doesn't get the effect of that nasal cavity, so air breathed in through your mouth is dirtier than air breathed in through your nose. It's also a little colder. That's why they encourage you when you're outside and it's cold to breathe through your nose. All right? Now, what if you got a situation where one of your nares, the opening, is blocked in your nose? Well, you still got to create that turbulent airflow. So in the nasal cavity itself, you have these little ridges. And these little ridges are called nasal concha. And these ridges then create that turbulent airflow. You got me? Now, when we get into it, I'll show you the lining of the respiratory tract, and that's important. All right. So watch. The nasal cavity is separated from the oral cavity by the hard palate. So there's a bone on the roof of your mouth that will actually come together and fuse while you're developing, and that separates the oral cavity from the nasal cavity. There's some people who have a cleft palate where the two bones, when they come together, don't completely fuse. As a result, they actually have a hole. Whoops. They have a hole. Here, and they can actually get food and stuff in here, or mucus will start getting into their mouth. And if you notice, you got this little indentation in your lip. So as your face is forming in the womb, it actually forms kind of from the outside in. So the two parts of your face actually come together and fuse together. That's why you got this little thingy here in your lip. And a lot of kids who develop a cleft palate also have a problem with their lip and their teeth, because their teeth don't come together either. And surgically, it's a pretty simple fix. And most of these kids, they don't have a lot of, they have some medical issues, obviously, but more of it is cosmetic. And you know how it is when you're little kids, you know, they pick on everything. So you can imagine having a kid with a cleft palate. That's got to be a tough life. All right. Now, watch. You have the hard palate, which is bone. Then you have the soft palate, which is tough cartilage. The function of the soft palate is to basically direct food into the esophagus. The soft palate separates the nasopharynx from the oropharynx. So it separates the back of the nasal cavity from the back of your throat. And what you don't want is you don't want stuff that you're eating or drinking to get into your nasal cavity. Now think about this for a minute. What's more important, to breathe or eat? Yeah, I'd want to breathe too, right? So if you're eating something or drinking something and somebody says something funny, to laugh, you take a breath in. So what will happen is this little soft palate doesn't seal off that area, and that stuff that's in the back of your throat gets thrust into your nasal cavity. And that's why if like you're drinking pop or something like that, it burns your nose. So don't do that. All right? Okay. Now, so we got the nasal cavity. Now you need to know these divisions. You with me? You should know the nasal concha, and then you should know the throat. The throat, the medical term for throat is pharynx. Did I spell that right? No, that's my dyslexia. You can, right here, pharynx. You got me? So the pharynx is divided into three parts. You have the nasopharynx, you have the oropharynx, and then you have the laryngopharynx. So the pharynx as a whole is divided into three parts: nasal, oral, and laryngopharynx. Now, right, where are they? Right here. Is there bad stuff in the air? Sure. So when you breathe in bad stuff, you don't want that bad stuff getting into your body. So there are lymphatic tissue. Lymphatic tissue is part of the immune system. And these guys are called the adenoids. And the adenoids are part of the lymphatic system, and they protect your nasal airway. So sometimes those can become inflamed because you're breathing in bad stuff, and they can actually block your nasal pharynx a little bit. And some kids, they're actually born with large adenoids and tonsils, and in order to get air in when they're sleeping, they actually have to kind of really develop a lot of pressure, so they'll start snoring. So if you have a 5 or 6 year old and they're snoring, you need to have that evaluated. They shouldn't be snoring unless they've been drinking. Yeah. Okay. Now, watch. You have, in the back of your throat here, you have what are called the pharyngeal tonsils. Those are those two big strips in the back, and they protect your oral airway. They're called pharyngeal tonsils. And those guys protect your oral airway. In addition, you have underneath your tongue, you have the lingual tonsils. The lingual tonsils also protect your oral airway. Now, and you're going to have to know these for the lab final. You have sinuses in your skull. And the sinuses have the same respiratory lining as the respiratory tract, right? So they're vascular and they also secrete mucus. Now, let me just make this a little bigger here. In the front, you have, oddly enough, the frontal sinuses. So these guys here. And then you have the maxillary sinuses. So the maxillary sinuses and the frontal sinuses, they will drain mucus into the back of your throat, into the nasal pharynx. Now, there are actually little tiny holes in the sinuses that allow that mucus to drain. But if you have sinus problems, you get inflammation, and those little holes get blocked off. So what happens is the mucus is still produced, but it can't be drained. So as that mucus starts building up, it starts putting pressure in your sinuses, and that's what produces a sinus headache. So if you go to the doctor and he suspects you or she suspects you of having a sinus infection, what they'll do is they'll go like this, and they'll tap. And if they're inflamed, that's going to produce pain when you do that. And that's how they actually diagnose sinus infections. All right? So the functions of the sinuses are really to, number one, got it right here, whoops, is to reduce the weight of the skull. So if it wasn't for those sinuses, your gourd would weigh a lot. And it also allows the skull and the pressure inside the skull to accommodate changes in atmospheric pressure. If you've ever gone on a plane, and when they change the pressure in the cabin, if you have sinus problems or any goo in your sinuses, that stuff will actually start coming out, and if it doesn't, you're starting to get a really bad headache. And then it's really important that you get this. It has the same lining as the respiratory system. So it's lined with cilia, and we learned when we talked about the cell that cilia moves stuff, and one of the things that it moves is that mucus blanket. And then there's tiny holes in the sinuses called the ostia that allow that mucus to be drained into the back of your throat. That's why one of the reasons that people wake up with a sore throat if they have sinus problems is because when they're sleeping, all of that mucus will drain into the back of their throat, and that mucus can have bacteria in it, and that will cause inflammation. That's why sinus problems can lead to sore throat. All right? Okay. Now, you also have in the base of your skull, you have two more sets of sinuses. So let's go through them. You have actually 4 pairs of sinus, right? You have a frontal pair, then you have a maxillary pair, and then you have the sphenoid sinuses, 2 of them, and then number 4 is the ethmoid. So each one is paired, so you have a total of 8 sinuses, 4 pairs of sinuses. So here you have the sphenoid sinus, and then right here you have the 2 smaller ethmoid sinuses. Now, I know we're not on this yet, but I'm going to show you anyways. In the middle ear, right here, that's usually air-filled, and there's an auditory tube or eustachian tube that's connected to your nasal pharynx. And that tube is muscular. And normally the muscle in that eustachian tube is contracted, right? So that eustachian tube is closed. But when you go into an airplane and they change the atmospheric pressure, then the pressure in the external ear has to be equal to the pressure in the middle ear. So the only way to do that is to allow that muscle to relax, and then it will allow for changes in atmospheric pressure. So that's why chewing gum or swallowing, it will relax that muscle, and that's what allows you to change the pressure in your ear so your eardrums don't pop. The other thing is that little kids, they have this eustachian tube or auditory tube that is much more at an acute angle. So any goo that's produced in the middle ear, that tends to have a hard time getting into the back of the throat. That's why kids under the age of 5, they develop ear infections, middle ear infections routinely. As an adult, you should not be developing ear infections. If you are, then there's something going on. All right?
What happens when they put tubes in my ears? Because I had to put tubes in my ears because I had really bad infections in my throat.
You still have them in there?
I guess they fall out.
Yeah, they do.
I had to get them put in my ear twice.
Do you have video of that? I was going to give you extra credit if you did. Let me show you that real quick. Where do they put the tubes? Here, I'll show you. Here's the tympanic membrane. The tympanic membrane is a thin, translucent membrane. It's like the top of a drum, right? So when sound comes in, it will vibrate. And you can actually see the little small bones that are connected to this tympanic membrane. In a normal tympanic membrane, you should be able to see through it, right? So you should actually be able to see the bones in the middle ear. And the tympanic membrane actually seals off the middle ear from the external ear. Now, if you have infection in your middle ear, so behind the eardrum, and it's not draining, and it's not very vascular back there, not a lot of blood, so what they will do is to prevent the rupturing of your eardrum, they will insert these tubes. So they go right through the eardrum, and then any goo can fall out, drain out. And the body does stuff that makes sense. If there's infection, the body is going to try to get rid of it. So that's why if you got like a big boil on your butt, right, it starts to become red and it starts moving to the top. That's because it's trying to push the infection out of your body. So with that tube, it allows that infection to drain. And once the infection is cleared up, then the immune system will say, look, I don't need this tube in here anymore, that ain't me. And the immune system will actually start to push it out, and then it will seal off the eardrum. That's how it works. And in some cases, if it doesn't come out, then they just go in and they just pull it out. But that's where they put the tubes. A lot of times if you have kids that needed tubes, you'll find them in their pillow or in their bed, and they basically fell out. But they don't usually stay in that long, just enough to clear up the infection. What you don't want to happen is that inflammation and that infection gets bad where it ruptures the eardrum, because if you rupture the eardrum enough, then it doesn't heal correctly, and you will form scar tissue, and kids can lose hearing from that.
It happened to me actually. In my ear.
Where they ruptured so many times, they got scarred? Yeah.
And they actually had to take tissue out of the back of my ear, and they had to put it in my
Yep.
eardrum.
Yep. Yeah. So most of the time doctors don't want to treat ear infections because they don't want kids to develop antibiotic resistance. They just don't want that, because if there's a real bad infection, then they have to use really heavy duty antibiotics to kill it. So, parents don't understand this. So I'm not leaving until I get my amoxicillin. And you know, they want to take care of their kid. You know, okay, it's 5 hours and 59 minutes. So get ready. You know, we're going to give the kid the antibiotic. And they want to feel like they're doing something for their kid, when in fact they're probably doing harm to their kid by giving them those antibiotics routinely. So that's how it works. Anyways, got a kind of off subject there a little bit. Can I show you this? Where's your tear gland? That's what everybody thinks, right? So, watch. Everyone thinks it's here. What?
Those were the ducts, not the glands that were going to.
What were you what?
The ducts, not the glands.
Yeah, so just watch this real quick. All right. If you're going to clean a window, you're not going to start here, right? You're going to start at the top. So the tear gland is actually in the upper eyelid. And there's little canals here that will drain the excess tears, and then they drain into the nose. You got me?
I thought they're more like right, like in the corner though, aren't they?
No.
That's where the pediatrician told us to like, when they had clogged eye ducts, is to like put a Q-tip or your finger right here.
Yeah, no, that's, if they got a clogged duct, the duct is clogged here.
Well, like they said, I meant the gland. Like they said to start right there and
Yeah.
push it.
Yeah. Just real quick, do you want to know why your nose runs when it's cold out? Okay. I'll have to look it up. Okay, here we go. All right. So that's the upper airway. You should know the divisions of the upper airway, right? You should know the structures within the upper airway. And then you should know the functions of the upper airway. All right? Now, watch. There's a flap of cartilage that covers the trachea when you're eating food, and that flap of cartilage is called the epiglottis. So the epiglottis covers the trachea when you're eating, so that food doesn't get sucked into your respiratory tract. All right? Now, what I'm going to do is I'm going to show you the structure of the larynx. So the larynx, another name for larynx is Adam's apple, and the larynx is actually made of 3 parts. You have the hyoid bone, and the hyoid bone anchors the base of the tongue. The hyoid bone is the only bone of the body that doesn't articulate or form a joint with another bone. So it's essentially a free-floating bone. Then you have the thyroid cartilage, and then you have the cricoid cartilage. And those form the larynx. And the larynx houses the vocal cords. So I'll show you. So here, they're doing a little bronchoscopy. I'm looking for something. All right, so if you stop right here, here is the epiglottis, right? Then you have the hyoid bone, and then you have the vocal cords. So the vocal cords are actually thin pieces of tissue that will actually vibrate as air passes them. So this is important, you should know this.
Should say that.
What's that?
Shouldn't say that. 3 points of credit.
Oh, did I say that?
Yeah, you said at the beginning.
Oh, okay. Yep. All right, you get 30 points of extra credit. So whatever that transfers into multiple guess test, you get. All right. Dang it. I gotta stop saying that. All right. So watch. Here are the vocal cords right here. The opening between the vocal cords is called the glottis.
I thought you had a cat in your car. You said that's the opening of the vocal cord?
Right, the opening between the vocal cords is called the glottis. All right? So watch. Epiglottis, hyoid bone, vocal cords, glottis. You got it? All right. So watch. So this person is moving air through it. Hang on. And then they will begin to vibrate. You see them vibrate? And then how you move your mouth or tongue will determine the words that come out. Now, watch. It looks like a what? I know, it kind of does, right? Now watch. When you have laryngitis, you get inflammation of these vocal cords. And if the inflammation is bad enough, they thicken and you can't vibrate them. That's why you lose your voice if you get laryngitis, because they become inflamed and they'll actually kind of, not really, but kind of stick together, and they won't be able to vibrate, so that's why you lose your voice with laryngitis. And then if you are a really good singer, like me, sometimes you develop, because you use your vocal cords a lot, and you damage them over time, you can develop scar tissue on it or polyps. That's why some of these people who sing a lot, they have to actually go in for polyp surgery. So those are the vocal cords. Remember, the opening between the vocal cords is called the glottis, and then that connective tissue that covers the larynx when you're eating, that's the epiglottis. All right. And then you should know the 3 structures that make up your larynx. Also, oh darn it, hang on. One of the things that you should be able to notice is that for the most part, women have a smaller diameter trachea. So if you're looking down, right, you chop somebody's head off and you look down the larynx, men have a larger diameter trachea. That's what produces a lower pitch voice in men than women. So that's why guys' Adam's apple sticks out and a woman's typically doesn't. All right? Okay. Now, above the larynx and up. So, above the larynx, that includes the laryngopharynx, the oropharynx, the nasopharynx, the nasal cavity, and the sinuses. That is the upper airway. That's the upper airway. So if you have a sinus infection or you have a sore throat, you have an upper respiratory infection. You got me? All right. So immediately connected to the larynx is the trachea. And the trachea is made up of C-shaped cartilage rings. Now, the reason they're C-shaped is what's directly in back of the trachea? That's the esophagus. When you're eating food, that esophagus will expand, and if it was completely O-shaped, then you would feel those little O-shaped cartilage rings as you're swallowing your cheeseburger. So that's why. So there's actually again, if you're looking from the top, here's a C-shaped cartilage ring, and then you have this tough band of flexible connective tissue. And then the esophagus is here. So when you're eating something, it allows the esophagus to expand a little bit to accommodate that food. That's why if you eat a big hunk of food and you try to swallow it, you will actually, it kind of feels like there's razor blades in there. And the reason for that is the esophagus has expanded, and it's actually kind of rubbing on the edges of those cartilage rings. So just chew your food like 27 times. All right. Okay. So what I want you to be able to do is I want you to be able to trace the path air takes from the environment all the way down into the alveoli. All right? So we've talked about the upper airway. Air enters the nares, right? Your little nostrils. And then the nasal cavity, right? Then the nasopharynx, oropharynx, laryngopharynx, and then the larynx. Are you with me, guys? Then that air is going to enter the trachea. So here, just like in the cardiovascular system, you break the airway into progressively smaller and smaller parts. So you have the trachea, and then you have the two main stem bronchi, left and right. And as you can see, the left main stem bronchi is at a more of an acute angle. And that's because you got to have room for the heart. All right? Then, watch, main stem bronchus. You with me? And then they're going to branch into what are called lobar bronchus. So here are lobar bronchus. And each lobar bronchus supplies a lobe of the lung. So if you look, you have 1, 2, whoops, hang on. You have 1, 2, 3 lobar bronchus in the right. That's because the right lung has 3 lobes. And then the left, 1, 2 lobar bronchus, because the left lung has 2 lobes. And then each lobe is then divided into a small segment. So you will then have the lobar bronchus then split into the segmental bronchus. And then each one of the segmental bronchus branch into these smaller airways called bronchioles. Now, and this is, whoop, almost said it. As you move deeper and deeper into the respiratory tract, the amount of cartilage decreases in the airway. So the most cartilage you're going to find is in the trachea, and then as you progressively get deeper, it is going to become less and less. Thank you. Now, when you get to the bronchioles are made of smooth muscle. And the bronchioles can contract and relax. So when the bronchial muscle contracts, you get bronchoconstriction. And when the bronchial muscle relaxes, you get bronchodilation. Now, when someone has asthma, asthma is an allergy in your respiratory tract, and it primarily occurs in the bronchioles. And it causes that bronchial muscle to constrict, so the person can't get air in. So what do? You take a bronchodilator. So a medicine that's going to cause the smooth muscle of the bronchioles to open to allow you to get air in. All right? Now, the bronchioles then are connected to a series of one cell thick air sacs called alveoli. A single alveoli is an alveolus. When you have a bunch of them together, and I'll show you a little better picture in a minute, you have alveoli. And it is in the alveoli that you exchange oxygen and CO2. Now, we learned that every alveoli is associated with a pulmonary capillary. And if you recall from our study of the circulation that the venous blood that's being pumped by the right side of the heart is high in carbon dioxide, and the air that you're taking into your alveoli, that air is high in oxygen. So the CO2 is going to leave and you're going to expel it, and then the oxygen is going to come into the blood. So this is where the rubber meets the road, essentially. This is where gas exchange occurs in the lungs and with the circulation. So there's a term for this, and this term is called external respiration. So external respiration is the exchange of oxygen and carbon dioxide at the level of the alveoli and the pulmonary capillary. That's external respiration. Now, if you recall, once that blood is oxygenated, that blood will then travel out of the lungs and back to the left side of the heart. And then the left side of the heart is going to send that blood down to the cells. So, and if you recall, at the level of the systemic capillary and the cell, we know that the cell produces carbon dioxide as a waste product, and that the arterial end of the capillary is high in oxygen. So oxygen's going to go into the cell, CO2 is going to leave, and arterial blood will become venous blood. And then all that venous blood comes back to the right side of the heart and gets shot into the lungs. And then that cycle continues. Now, when you exchange oxygen and carbon dioxide at the systemic capillary in the cell, that is referred to as internal respiration. So respiration really refers to the exchange of gas, but there's actually two components. You have an internal and external respiration. And you should know where both of those occur. All right? Now, what I want to do now is I want to explain to you the lining of the respiratory tract, what it actually is and what it's made of and what its function is. Okay. Now, literally from your nose all the way down into your bronchioles, you have this special lining. And this lining of the respiratory tract is, number one, very vascular. Tons of blood vessels. Number two, the lining is ciliated. And we know that cilia are extensions of the cell membrane that will actually beat in one direction, right? And in the case of the respiratory tract, the cilia beat from the lower airway to the upper airway. And number three is they have these specialized cells called goblet cells. And goblet cells secrete mucus. So the function of the mucus is to trap any impurities that are in the air, and then that mucus rides on the cilia. And any bad stuff that entered will be caught by that mucus blanket, and then the cilia will beat that mucus along with the goo that it caught to the back of your throat. Now, smoking cigarettes paralyzes cilia. It doesn't destroy them, it paralyzes them. So when people have smoked for a long period of time, they have to kind of plunge their lungs, and they do that by coughing. Now, some people, once they stop smoking, they'll actually cough more than they did before. That's because the cilia are not exposed to the nicotine anymore, so they become unparalyzed, and they'll start beating again, cleaning your lungs. There's a point at which it doesn't matter anymore if you stop, and meaning the cilia just ain't going to come back to life anymore, and you have COPD.
Is there anything else other than smoking that paralyzes or destroys the cilia?
If there is, I don't know about it. So, and I explained to you, did I explain to you cystic fibrosis? Yeah. So, what's important to remember is this ciliated lining goes all the way from basically your nose all the way down to your bronchioles. And its function is to clean the respiratory tract. Now, one of the things that happens, especially with babies, is babies' lungs are completely developed when they're born, meaning they can breathe air in and remove CO2. The problem lies with the alveoli. So I'll label this for you. Now, when you take a breath in, right, you expand your lungs. So air goes into your lungs. So when you take a breath in, air fills the airways, and it will also fill and expand the alveoli. But when you blow that breath out, what will happen